Okay, what I want to talk about now is a way to help alleviate some back pain. And one of the things that I see for a lot of people when I meet with them for the first time, either here in the studio or just out and about, and we happen to be in a seated position, I'm going to see a lot of this kind of posture. And in this particular posture, they're seated, and the back being rounded is, what people typically do because it's comfortable, right? So one of the things that I do to help start my morning, I have my own ritual morning stretches as mobility drills. And I get these done, prior to starting the day, either when I get up from a desk. I have a series of different stretches, but one of the things that I'll do to help alleviate back pain is real simple. You can do this at home, you can do this, on the couch or at the office. And you want to sit in the most upright posture that you can be in. Again, you want to be here, not here. Okay, so from this position, we're going to take one leg, we're going to cross the ankle over the opposite knee. Now, what I want to do is focus your attention on the kneecap all the way back to the foot. I want you to pay attention to that distance there, so that when we switch legs, it's basically about the same, okay? The other thing I'd like you to pay attention to is where this knee is right now before we start. The knee, for some, if they're not really flexible here in the gluteal area or external rotators, which affect the back, they're going to have that knee hiked up quite a bit. And I see this, I'll show you on my opposite side, it's just like that. So first thing we're going to do is we're going to get that ankle across the opposite knee. We're going to measure that distance from the knee to the ankle so that we get some symmetrical, movement on the other side when we start this process. There's two basic things I'm going to do. First step, I'm going to push down on this knee, and I'm going to give it, about 20-30% of my ability. I'm not going to really try to torque it down like I'm, doing a push down or moving a lot of weight, but I want to push to a place where I get the first sign of resistance right here in this bunch of hip capsule muscle, or hip flexor. I want to push that down, and I want to count, 5, 4, 3, 2, 1, and I just want to release it. Want to give it a little break for a moment. This second run that I make at it, I'm going to push into it, but the next time, the second time, I'm going to push up with my leg into my hand, so it's going to provide a little bit of resistance for the push. And we'll give it a real brief go here. 1, 2, 3, 4, 5, and then release my leg pushing up into my hand. And notice that distance increase. All right. Now I have a new range of motion established here. I'm going to do this one more time for a count of 5 while pushing down into my knee and my knee pushing into my hand. Here I go. 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5. And I'll get maybe another inch or two. Okay, and I'll do this for a cycle of 1 or 2 times in this direction. Now, my new position, a little bit lower than the first time when I started. Now, the second part is we're going to do a forward lean, forward flexion at the hip. And you're going to feel a whole lot of excitement back here. I call it that sexy feeling, right? You're going to feel real special. So firstly, we want to make sure that our posture is nice and tall. We're sitting nice and square. We've got that distance maintained. I usually will grab that ankle with my fingertips pressed into my knee at the same time to keep that distance from changing. And I'm going to put my other hand here. You may, if you have challenges with lateral collateral knee pain or the outside of the knee, gripping it here. But while we're in the seated position upright, we're going to inhale and exhale. And we're going to move to that very first point of resistance. You'll feel the initial bite in that hip, and you'll experience a really sexy feeling. Getting a second inhalation, a third, a fourth, we may hold this position for a cycle of 3 deep diaphragmatic breaths. that third exhale, just let it fall your upper torso a little bit further. Okay. Now you can twist the torso and search around for the hottest spot by bringing your belly button and sternum, your breastbone here, down closer towards the ankle. And you're going to experience even more additional stretch. Once you come out of that stretch and you move that leg, you'll be able to feel a sense of more mobility in that hip. Now, you know, you can do a basic test and walk and see with just doing one side and see how that feels. If you already have a problem side, my problem side or my challenge side is my left side. So I'm going to bring that left ankle over. I'm going to try to get that same distance from the knee to the foot. And right now you can already see the height here that I have in this knee. My internal and external rotators in my hip. And you know, when you rotate your foot in this way, this is your internal rotator. When you rotate your foot this way, that's your external rotators at the hip. So my external rotators and internal rotators are very, very tight. So I have to spend some time here just loosening this up. And again, this could be years of training. You know, I've been training for almost 4 decades now. The process for me is, you know, a daily ritual just so I can keep my body moving pain-free. I do not like to feel the pain, and I'm sure a lot of you are the same way. We're going to do this first step here. We're going to push down into that knee for a count of 5. I'm not going to resist it yet. And I've already gotten a little bit more range of motion, but I'm feeling a whole lot of excitement, sexy feeling in that hip, because it's the tight hip of the two. And typically I'll start with this side. Now, I'm going to give it the assisted stretch, the PNF, the neuromuscular facilitation. Now I'm going to give it that assisted action, pushing up into my hand, pushing up for 5, 4, 3, 2, 1, giving it that new range of motion. Inhale and exhale, and I'll feel quite a bite in the hip. Letting it relax for those 2 or 3 deep diaphragmatic breaths. I'm going to go at it again. One more assisted stretch. 5, 4, 3, 2, 1, and relax into it. And now, it's probably not yet quite as the other side is when I release, but it's pretty darn good. So it's an improvement that you can recognizably see visibly. Once I get up and move, I'll feel that release in the hip. Back pain that was there before may disappear. Knee pain that might be present because of a misalignment at the pelvis can be gone as well. So we're in this position now. We're going to do that second phase, sitting up nice and tall, and inhaling and leaning into the stretch. And right away, because of the tension here in my external rotators, I feel an extreme amount of bite. We'll go through a couple of cycles. Now I can also do assisted stretching here in this position by pushing down in this leg, down into the other thigh. For a count of 5, 4, 3, 2, 1. That increases again that range of motion. I'm going to do it one more time, pushing down. 5, 4, 3, 2, 1. And a huge difference. Extreme amount of burning sensation, but not necessarily so painful that I make the pain face, or what I call the O face, as I'm pushing into it. Once I release, coming up, cycling the leg, and I'll, go for a baseline walk to retest, but a lot of pressure in the pelvic girdle You know, women wearing high heels or sitting at a desk most of the day, lots and lots of pressure, lots and lots of stuff going on here. But this is a real simple strategy to help relieve a lot of the back pain as a result of our modern day society and sitting a great deal. You could do this, you know, and obviously without all the explanation, you can get it done in about 2 to 5 minutes. You know, maybe a minute or two on one side, a minute or two on the other, and then get yourself up and see how you're walking and how that feels. Okay, and let that be your test. You feel back pain or you've been feeling back pain for a while, do this simple seated stretch and assisted stretch yourself. See if you can get some relief. If you feel relief, let that be a sign to you that you want to work on getting some time daily to repeat this stretch. Okay? My name is Emile Jarreau, aka Mr. Fat Loss. This is M2 Fitness Pros in Long Beach, California. This is the M2 Mobility Daily.